Let's talk about blood tests. You go in, you get the draw, and you trust those results to tell you the real story about your health. But what if I told you that simple things you do in the 48 hours beforehand can basically turn those results into a work of fiction? Well, today we're going to break down the 10 biggest mistakes people make so you can avoid them. Just imagine this for a second. A super healthy 35-year-old marathon runner gets her blood test results back, and they show severe liver damage. This triggers months of pure anxiety, a ton of unnecessary follow-up tests, and what was the real cause? It wasn't some hidden disease. It was just an intense workout she did that very morning. And believe me, this isn't some rare one-off story. This kind of thing happens in clinics every single day. And if you think that's just a wild anecdote, listen to this. A huge study from Johns Hopkins just last year found that nearly 40%, 40%, of blood tests have significant inaccuracies. And we're not talking about tiny little variations here. We're talking about errors big enough to lead to a completely wrong diagnosis, getting the wrong prescription, and a whole world of stress. All because of simple prep mistakes that are totally preventable. Yeah, these errors create this massive, hidden problem in our healthcare system. But here's the really empowering part. Every single one of these mistakes is avoidable. You just need the right knowledge, and you can make absolutely sure your results are reflecting your actual health, not some fake story created by a simple slip-up. Okay, so let's jump right in and start with the most common culprits, all the things we eat, drink, and take. From your morning supplements to that casual glass of wine with dinner, what you put into your body can totally rewrite your blood chemistry. Let's look at exactly what you need to get under control.
So what's fascinating here is that very first one, biotin. Millions of us take it for better hair and nails, right? But check this out. Research from the Mayo Clinic shows it can actually physically mess with the lab equipment for more than 40 different tests. It's not actually changing your body, it's literally breaking the test itself. So the takeaway is absolutely crucial. You have to stop biotin a full 72 hours before a blood draw. And rule number 1 always is to tell your doctor every single thing you take, even if it's just over the counter.
And what about that harmless glass of wine you had with dinner? Yeah, that matters way more than you think. The second you drink alcohol, your liver basically drops everything it's doing because it sees it as a toxin it needs to process right now. That whole process can keep your liver enzymes jacked up for up to 72 hours, making it look like you might have liver disease. It also causes a huge spike in triglycerides. So, the best practice? No alcohol. At all. For at least 3 days before your test. Okay, get this. An incredible 78% of people make this next mistake: eating the wrong stuff before a test. Even if your test doesn't require fasting, a big, fatty meal, like a pizza the night before, can spike your triglycerides so high that it literally makes your blood sample cloudy and impossible for the lab to even analyze. And look at red meat. It can spike creatinine, which is a key marker for kidney function. There's a true story about a bodybuilder who ate a giant steak, and his results came back suggesting he had stage 2 kidney disease. They did a retest after he avoided meat, and guess what? His kidneys were perfectly fine. But honestly, all of those mistakes we just talked about, they pale in comparison to this next one. This is the granddaddy of all blood test errors. It's responsible for more messed up diagnoses than pretty much all the other prep mistakes combined.
Not fasting correctly. And when a doctor says fasting, they mean it in the absolute strictest sense of the word. It means nothing but plain water. That piece of gum you're chewing? It has calories, and it can absolutely raise your glucose levels. That little splash of cream in your morning coffee? That can send your triglyceride levels soaring by 50%. Seriously. If a test says you need to fast, it is completely non-negotiable. Even the tiniest little cheat can throw the whole thing off.
But hey, it's not just about what you're putting in your body. Your body's physical state at the very moment of the draw is just as important. How you exercise, how much water you've had, and even how you feel emotionally can completely rewrite your results. Remember that marathon runner from the beginning? Well, a perfectly healthy, normal session at the gym can make your blood work look like you've just had a heart attack. No joke. When you do intense exercise, you create tiny micro tears in your muscles, and that releases a flood of enzymes like creatine kinase. Your liver enzymes and inflammation markers also go through the roof. It's the perfect illustration of why you have to avoid any tough workouts for at least 48 hours before a test. It's all about avoiding that false alarm. All right, let's bust a huge myth. That old advice to not drink anything, not even water, before a test, it's just wrong, and it can actually be harmful. When you're dehydrated, your blood gets more concentrated, which makes it look like you have higher levels of, well, everything. It can falsely pump up your kidney markers and your red blood cell counts. The key here is just balance. Drink your normal amount of plain water. You just want to make sure your blood isn't too concentrated or too diluted. You know, your mind has an incredibly powerful effect on your body's chemistry. A 2024 Harvard study found that just the anxiety of getting a blood draw, what they call the white coat effect, can raise your blood sugar by 18 points and your cortisol levels by 45%. The solution, though, is pretty simple. Just get there early, do some deep breathing, whatever you need to do to feel calm. These little actions could be the difference between a normal result and one that gets you a pre-diabetic diagnosis. Okay. For our last section, let's talk about logistics. These are the small, nitty-gritty details of the draw itself, the kinds of things you actually have complete control over, and they can make a massive difference in how accurate your results are.
Your body runs on a 24-hour clock, a circadian rhythm. Hormones like cortisol and testosterone are way higher in the morning, sometimes by up to 50%. So if you get tested in the afternoon, you could easily get a false diagnosis for something like low testosterone or adrenal problems. That's why nearly all the normal ranges are based on morning blood draws. The point is, always try to get your blood drawn early, ideally between 7 and 10 a.m. That's when you'll get the most accurate picture.
Okay, this one might be the most surprising of all. Just walking from the parking lot and then immediately sitting down for your test can actually skew your results. See, when you're standing up, gravity pulls fluid out of your blood vessels, which concentrates things like proteins and cholesterol. The solution is what's called the 15-minute stillness protocol. Just get there early, sit down quietly, and let your body chemistry settle. And please, whatever you do, do not pump your fist. That can falsely spike your potassium, which is a really critical marker for your heart health. And finally, which arm they use is not a small detail. It's non-negotiable. Drawing blood from an arm that has an IV in it can be a disaster. There was one case where a patient's blood sugar was read at 450, which is severely diabetic, when their actual level was a perfectly normal 95. It was all because of contamination from a sugar IV. You have to speak up. Tell the person drawing your blood, the phlebotomist, about any IVs, recent shots, or procedures. You have to be your own advocate in that room.
So after hearing about all these things that can go wrong, it might feel a little overwhelming. But I really want you to see this not as a list of scary warnings, but as a toolkit. This is your path to taking control of the process and making sure the story your blood tells is the true one.
And here it is, all in one place. This is your pre-test checklist. Think of it as your cheat sheet. Before your next blood draw, just run through this list. Confirm the rules with your doctor, pause the supplements you need to, skip the alcohol and the hard workout, drink some water, and give yourself that 15 minutes to just sit and relax at the lab. You are completely in the driver's seat of your own health diagnostics.
These 10 mistakes are literally the difference between getting accurate information about your health and getting a misdiagnosis that could change your life. But the good news is, you now have the knowledge to avoid every single one of them. So I'll just leave you with this question. The next time you get a blood test, will it be telling the truth about your health?